Hi, everyone. My name is Trinice Jones, and for this policy analysis assignment, I chose to focus on the mental health policy because mental health is such an important factor in just day to day life. And nowadays, it's become one of the most significant public health issues in the United States. Millions of people experience mental health conditions each year, but unfortunately still face barriers to get adequate and access affordable and timely treatment. So that's why I decided to choose this policy because of the importance of mental health. Um, as I researched this topic, I realized that having health insurance does not always guarantee equal access to mental health services, which is why strengthening mental health parity laws is so important. In mental health parity, it's just making sure that mental health is covered by insurance just as much as physical health is. So, the stakeholder perspective that I found the most influential was the stakeholder of the patient. Mental health patients are so underserved, and mental health, like I said before, is such an important thing because it determines how we go about our day to day lives. And it's just as important as physical health, and it affects how we go about our physical health as well. So, that's why I chose that patients and their families are one of the most influential stakeholders. They're directly affected, patients are directly affected by insurance companies that place stricter limits on mental health services than on medical or surgical care. Delays in treatment, high out of pocket costs, and limited provider networks can prevent people from getting the timely help that they need. One of my policy recommendations is to just strengthen the enforcement of the Mental Health Parity and Addiction Equity Act. Although this law requires insurance companies to provide equal coverage for mental health and physical health services, enforce, enforcement of this law remain inconsistent. And I recommend increasing oversight in the insurance companies and requiring greater transparency in how mental health benefits are administered and expanding provider networks as well. These changes would help ensure that individuals receive the mental health care that they're legally entitled to and that they need without unnecessary barriers. One challenge that could arise from implementing this recommendation is the increased cost for insurance companies and healthcare systems. Even though expanding provider networks and improving compliance monitoring may require additional financial resources and administrative efforts, I do feel like that may be a great barrier, but based off of the mental health needs, I think it can be overcome as well. The most important thing that I learned from completing this assignment is that health policy has a direct impact on all of our lives. All of the health policies that were given as options are so important. But like I said earlier in this video, mental health is the one that impacts me the most. And so, yeah, policies are just not written on paper, they impact us in our daily lives. So, that's the most important thing that I learned. And I really enjoyed researching this assignment. Thank you.